Welcome to Vital Signs. We are excited to have you here today. We are here because we like to share all things that are disruptive in healthcare, wellness, new things that are emerging, and also old things as well, because that's how healthcare rolls. I am Jen Gaudet, your amazing host, and I am really excited because we have a special guest here in studio today who is going to really shed some light on emergency care, the things that you don't know but really wish you did when something does happen. I'm happy to welcome Christopher Turner of EMERGICON to the studio. Welcome.
Thank you so much. I appreciate it.
So, Chris, spill it. What are the things that we don't know when an emergency happens?
Thanks for having me. It's our pleasure to work with Fire and EMS in Texas. And really the two things I'd say are, one, there's almost always a bill associated with a medical transport. Almost always. That surprises people a lot of times. It's important that you know that. It's important that you're your own advocate, because it is often a misunderstood process. And then two, as an individual, your distance to the hospital and distance to care is super important to understand. Where you live, where you travel, that can make a lot of difference when an emergency happens.
So, hold up. The bill that you're talking about, it's different than the bill that happens when you actually get to an emergency room or in an emergency system.
That is correct. It is correct. And it gets complicated because providers are usually cities, counties, emergency services districts. So there's a medical bill associated with what they do, and they are almost always not contracted providers with insurance for probably a few obvious reasons. So then it's an out-of-network bill, a lot of times that the insurance plan just doesn't understand.
And so talk to me about this process, because here in Texas, we have very high property taxes, and that's supposed to cover our emergency services. Why is there that separate bill, even though we're paying for emergency services in our taxes?
It does and it doesn't. And the way it does is there's this coordination of our trauma system in Texas. Very, very impressive if you're ever exposed to the way that they respond to disasters, all kinds of things that happen. And those taxes pay for readiness. So the 24/7 readiness, if you have to dial 911, there are responding agencies. It doesn't pay for utilization when you're actually using medical supplies, putting on individual hours of paramedics and EMTs, and on the air there's flight nurses. So that comes to utilization, and that's when a medical reimbursement situation arises.
Man, this is super confusing. No wonder that we freak out when something happens. I've had to utilize EMS in the past, and I was shocked by all of the different bills that happened.
Yep.
and all of the different providers, because it wasn't something that I was aware of. So thank you so much for kind of shedding some light on that. And before the show, we were kind of talking a little bit about what happens if you live outside of a metro area, because much of Texas is kind of rural or suburban and spread, and we don't necessarily have a hospital right down the street from us.
Correct. So my wife and I moved out of the city of Dallas a few years ago, and the first thing I did is I looked at the closest hospital and what level of trauma center it was, and then I looked at the EMS providers in our area. And I encourage everybody to do that and have an understanding. In an emergency is not the best time to try to figure that out. And not that you have control over who responds or even where you go sometimes, but it's helpful to be informed and get an idea. If you've chosen to live in a rural area, are you 45 minutes from a trauma center? Are you 10 minutes? Those are big differences.
So hold up, not all hospitals are trauma centers?
Not all hospitals are trauma centers, and they're not all the same level of trauma center.
And so as our viewers and our listeners are taking this in, how can they determine whether the hospital that's nearest them is a trauma center, or how can they find that information or get that knowledge?
Go online. Very easy. Hospitals generally will have information there about what level of trauma center their emergency department is. If they don't have an emergency department, that's a clue right there. They're not taking patients into an emergency room. And go online, and then if you don't know, call and ask about what types of incidents they're prepared to handle 24/7. Do they have the appropriate staff for heart attacks, things like that. And then also talk to your local EMS agency. EMS agencies do amazing, amazing things. They're staffed by amazing people who deal with things we can only ever not even imagine. They are woefully underfunded and underpaid, I'll say that, but they are more than willing to talk to you, particularly maybe you have an elderly parent or something, or you know you might need their services. They'd like to be on the forefront of that.
Okay, so I really love that we're diving into this because this is like demystifying what happens in an emergency. There's so much clouded and so much, it's like a spider web to try to get to the information. But, you know, as we learn this, as we discover where's the nearest trauma center, is the hospital near me even the one that I'm going to be treated at with whatever is happening in my emergency situation, we can be prepared and have that knowledge and make more informed decisions. But what else can we do in advance of an emergency if let's say we have a chronic disease or we have a parent with a chronic disease or something that might have an emergency situation? What are some of the things that we can do to prepare in the home or before an event happens to have that extra level of readiness for when an event does happen?
You know, there are all kinds of new services being offered in the healthcare space. So there's one up I just heard about, and I don't know if it's exclusive to Wichita Falls, but I think it's something along the lines of Black Bag, and it's nurse practitioners that come to homes. There are several EMS agencies that have instituted community paramedicine, and so that's an intent to help people in their home before they need access to go to the hospital. So really it works down to community by community in working with the local health, the hospital, your physician, the EMS provider, and just establishing that relationship of, we have an elderly parent living here, or they have maybe COPD, something like that. How does the EMS agency want that handled? Do they want you to go through 911? Do they have a local dispatch center? They'd rather you call them directly. All kinds of things can happen when you kind of open yourself up to who serves your community, and they're largely local people. The hospitals are usually local staff, all the EMS services are locally staffed. So talk to those people. They're more than happy to help. They're there for you, and they're there for the community, and they are there 24/7. It's just amazing to me how many people go to work at times that we all go to sleep.
And so, Chris, how did you get so knowledgeable about all things emergency care? I mean, tell me a little bit about what is it that EMERGICON does, and how did you gain this expertise? Because you've been doing this for a while.
Thank you. Really, my background is all in healthcare finance. As a kid, I thought I'd be a doctor. There was no way I'd get to that science. But my background is healthcare finance, and really my passion is about the people side of healthcare and not being clinical at all myself. What I saw over and over again was there's this confusing reimbursement scenario where at the end of the day, it's the person served that really kind of gets beat up by it. And so we all know, anybody who's had anything to do with healthcare, the bills are very confusing. The amounts are sometimes outrageous. And from the finance side, there's some understanding of that. From the public side, there's just no understanding whatsoever. So as I started out, my goal was to help clarify that as much as I could, so the provider understood where they could get reimbursed and where the patient just doesn't get abused by the system of reimbursement, sent to collections, all those things that happen. And that gets harder and harder as you get into emergency services.
And you were talking about that with me before the show. We were talking about how as the level of emergency gets more emergent, it becomes more and more convoluted and cloudy. What can we be doing as providers, as members of the community, so that's got a little bit more clarity moving forward?
There's probably a couple of things. One is if you need EMS services and if you have a bill that comes to you, you need to make sure that you contact your insurance company, because if they're denying it for some reason, you need to understand why that is. And a lot of times denials are not a result of something that's really not covered. They're really a result of not understanding. So you can imagine if it's your local township that runs fire and EMS, they submit a claim to a health insurance company, that may get denied because they just don't understand why they're getting a claim from a town, let's say, or a city. So there's that piece to understand. So be your own advocate there, or your family be your advocate on your behalf, and make sure you really understand what you owe and what you really don't owe, and come to some resolution. Secondly, anytime you're transported, there is a willingness on the part of the party who transported you to work with you on that outstanding amount. Always, always, it's always been my experience that they are more than willing to work with you in any number of ways because it's an unexpected medical bill and they're happy to help you get through that process.
So what I heard is make sure you advocate for yourself. If you get that bill, be sure to be calling your insurance company to make sure that it wasn't an accidental denial because they didn't understand what was going on. Clear it up. And then always talk to the provider because I know this firsthand. I've seen it like many years ago. They want to help you. They understand that you may need a payment plan. We do have to take a brief break, but we will be right back after these messages.